Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Okay, so now we'll be continuing the ATLS Primary Survey. So as we discussed earlier, we spoke about the steps involved in the ATLS. So we also discussed the full form of ATLS, that is Advanced Trauma Life Support. So steps we discussed, there is primary, there is secondary, as well as there is the definitive care. So we discussed all this in the previous video. And next we also spoke about the primary survey. You have the mnemonic A, B, C, D, E. So we already covered the A, that is the airway, and then the B, that was for the breathing. Now we again move on to the type C. So C, we left out with C, is for the circulation. So circulatory assessment. So you have the circulatory assessment, that is to control the hemorrhage. So you control the hemorrhage. So you control hemorrhage and maintain the circulatory volume and adequate end organ perfusion. So maintenance of the circulatory volume, and there is also the adequate end organ perfusion. So adequate end organ perfusion. Now moving forward, we have there is also a 2 wide bore which is to be known. The 2 wide bore. So this is the 2 wide bore and it is to be known, that is a 14 to 16 G. 14 to 16 G cannulae. They are inserted for the IV fluid resuscitation. This is for the IV fluid resuscitation. Then we move on to the type D. So A was for the airway, B is for the breathing, C is for the circulatory. Now D is again for the disability assessment. So we look at the disability assessment. So this disability assessment is to perform the basic neurological evaluation. So you do a neurological evaluation. So neurological evaluation. So under this there are some gradings such as the AVPU or the GCS, or you can include the P as well, and the blood glucose levels, and also you have the blood glucose level. Next we have something that is the E. The E stands for the exposure with the environment control. So this is nothing but exposure, and this is with the environmental control. So moving with this, this is to undress the patient and examine thoroughly for the possible injuries and prevent the hypothermia. So you look for the injuries, and this is by undressing, and you also prevent the hypothermia. So you prevent hypothermia. So we can write that. So to prevent hypothermia. Next we move on to the adjuncts of the primary survey. So what forms the adjunct of the primary survey? So under the adjuncts of the primary survey, there is firstly the blood collection. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.